A bruise, also known as a contusion, is a type of hematoma, which means that you are bleeding outside of a blood vessel. A bruise is always caused by internal bleeding which does not break through the skin, usually initiated by a blunt trauma. Most bruises are not very deep under the skin, so the bleeding causes a visible discoloration. The bruise then remains visible until the blood is either absorbed back into the tissues or cleared by immune system actions. Distress to tissue, such as being hit, causes capillaries to break under the skin, allowing blood to escape and build up. As time progresses, blood seeps into the surrounding tissues, causing the bruise to darken and spread. Nerve endings within the affected tissue detect the increased pressure, which, depending on severity and location, may be perceived as pain. The damaged capillary releases a hormone that causes narrowing of the blood vessel to minimize bleeding. The body will then create a temporary blood clot to plug the wound as the body heals. Often, the underlying tissue damage has been repaired long before the bruise disappears completely. Bruises often induce pain immediately after the trauma that results in their formation. Small bruises alone are not normally dangerous. However, some bruises can be serious, leading to other more life-threatening complications. Bruise coloring varies from red, blue, or almost black, depending on the severity. Darker colored bruises may result from a more severe bleed, and older bruises may appear more yellow, green, or brown. Bruise shapes may correspond directly to the instrument of injury, or be modified by additional factors such as age, sex, genetics, and skin tone. Bruises often become more prominent as time lapses, resulting in additional size and swelling, and may grow to a large size hours after the bruise was inflicted. Bruises can be scored on a scale from 0 to 5, called a harm score, to categorize the severity and danger of the injury. This ranges from light bruising with no damage to critical bruising with a risk of death. A harm score from 2 to 3 may be dangerous or cause serious complications, such as leading to blood flow issues. Treatment for light bruises is minimal and may include the RICE method, which is rest, ice, compression, and elevation, painkillers, and later in recovery, light stretching and exercises. Immediate application of ice while elevating the area may reduce or completely prevent swelling by restricting blood flow to the area and preventing internal bleeding. Very gently massaging the area and applying heat may encourage blood flow and relieve pain, although causing additional pain may indicate the massage is exacerbating the injury. These techniques should not be applied until at least 3 days following the initial damage to ensure all internal bleeding has stopped, because although increasing blood flow will allow more healing factors into the area and encourage drainage, if the injury is still bleeding, this will allow more blood to seep out of the wound and cause the bruise to become worse. Many ancient civilizations would purposely bruise their patient as a folk medicine treatment for some health problems. Many of these treatments are still used today in alternative medicine. The methods vary widely and include cupping, which uses suction to bruise, scraping, often with a gua sha instrument, which is scraped against the skin, and slapping,